Hi, Dr. Don Hayes, DC here, talking about your EndFlame blood test results. You either already have or will soon receive your EndFlame 3-page report that will provide valuable information on your immune system and your body's ability to stop inflammation. Before I share some general information on your EndFlame test, I want to talk about research on inflammation that includes the immune system's role in resolution of injuries. Professionals are taught that inflammation gets turned on due to an injury, a toxin, or a pathogen, and gets turned off by the immune system's process of resolution. Now, the problem for a lot of people is their immune system is not turning off the inflammation. When inflammation doesn't get turned off, instead of injuries going to resolution and repair, they end up as failed resolution, resulting in scar tissue, chronic inflammation, and/or chronic pain. The game changer in treating inflammation came with the discovery at Harvard of the resolvin molecule. Dr. Charles Sirhan, a professor at Harvard, is a scientist and the person who discovered a molecule in the blood that he named a resolvin that turns off inflammation and promotes resolution. He found that in order to make resolvins and turn off inflammation, a person must have a reservoir of EPA and DHA in their bloodstream greater than 8%. Since resolvins are genetic hormone-like molecules with a very short half-life, they don't circulate in the blood, and therefore they can't be measured directly using regular blood tests. However, since resolvins are made from omega-3s, you can test for an EPA and DHA deficiency to get a very accurate indication if a person can make resolvins when inflammation gets turned on. The EndFlame test that you took measured the omega-3, EPA, and DHA in your blood two ways. First, by testing your omega-3 index, and second, by testing your omega-6 to omega-3 ratio. Now, this brings me to your test results. In a minute, you'll receive the specific findings from your two tests. This is a sample of the omega-3 index report, and the percentage of EPA and DHA found in the blood is listed inside the blue circle at the top of the page. In this sample, the person has an omega-3 index of 5.75%, which indicates an EPA and DHA deficiency that needs to be urgently corrected. An index above 8% is considered normal by the lab, but most healthcare professionals suggest an index closer to 12% because research shows you can actually build up a reserve of potential resolvins for future needs. Now, this is a sample of the omega-6 to omega-3 ratio. This ratio correlates with a person's ability to turn off inflammation and prevent scar tissue formation. It also parallels a person's current risk of developing a chronic disease. A ratio of 3 to 1 or lower is considered normal by the lab, but again, many healthcare professionals recommend a ratio of 2 to 1 or lower. This is a pathology textbook drawing that shows there's only 3 ways that injuries heal. First, the top left corner shows a drawing of injured tissue. If the EndFlame test is normal and there's sufficient EPA and DHA to make resolvins, the injury will heal without scar tissue or chronic inflammation and look like the drawing in the top right corner. However, if there is a deficiency of EPA and DHA and the person can't make resolvins, their injury will proceed to either number 2, chronic inflammation, and look like the drawing in the bottom left corner, or to number 3, and develop into scar tissue with loss of function and look like the drawing in the bottom right corner. The EndFlame program is a research-based nutrition protocol that your healthcare provider may recommend to support your ability to heal without scar tissue or chronic inflammation. Your provider will use your EndFlame findings to determine your starting therapeutic dosage of Green's First omega-3s and polyphenols. In 30 days, it may be recommended that you take a follow-up EndFlame test to see if your initial dosage is increasing your EPA and DHA blood levels or if you need to increase the dose for the next 60 days. At 90 days, you'll get a final EndFlame test to make sure your blood levels of EPA and DHA are within normal range. If so, you'll be recommended a healthy diet and or a maintenance dose of Greens First nutrition and scheduled for a retest sometime in the future. In closing, Greens First products are first-in-class nutritional supplements with specialized pro-resolving mediators designed to help support the resolution of the immune response as a natural treatment for tissue injuries. The Greens First products you need and your specific dose will be discussed with you by your healthcare professional. This is Dr. Don Hayes, DC, saying, hey, thanks so much for watching. I'll see you next time. Bye for now.